Hi, this is Katie with Alpine Rescue Team. Today we're going to be talking about pelvic stabilization. It's a skill that would be used in case you have a victim that you suspect to sustain an injury to their pelvis or to their upper femurs, which is obviously a very significant injury. The mechanism automatically would call for full spinal immobilization, and because of the large amount of blood vessels and other vasculature that is inside the pelvis, it's very, very important that if there's something that's unstable there, that we stabilize it before we move our victim any more than is necessary. And the reason that we're doing that is one for pain control, and also to help protect those blood vessels to make sure that we minimize blood loss inside the pelvis. So as part of we would have already first performed our full primary and secondary surveys on the victim and treated her for shock. As you can see, we've already applied a C-collar and are maintaining spinal immobilization. The skill that we're going to perform is applying the pelvic wrap or the pelvic binder to Sabrina. The first step in this skill, we would have already checked our CSM and her lower extremities as part of our secondary survey. So the first thing we do before we log roll her is we're going to stabilize around her ankles, just with something to make sure that her feet don't move around any more than is necessary. And be careful as you pull those pelvic ends in, as you move her legs, because that's probably going to cause your victim quite a bit of discomfort. So try to minimize your moving there as much as possible. And Sabrina, do you have any questions about what we're doing here? No. Okay. And now keep in mind that the next step, we're going to be log rolling to position the pelvic wrap. Ideally, you could use a sheet or any material that has minimal stretch to it. We tried actually the skill in practice with a fleece or a long sleeve shirt, and a lot of those cotton or even fleece materials have a lot of stretch to them. Just be mindful of that if you are doing this with something other than a sheet. So as first thing we're going to do is we're going to position our pelvic wrap, and you want to position that about 1 inch to 2 inches above the top of the hip. And where you're trying to get the traction across the pelvis is right at the pubic symphysis, and the goal is to bring those trochanters at the tops of the femurs back into alignment. So we're going to go ahead and position this. If you were using a long spine board as well, you would position your sheet in the same place and only roll your patient one time. So you would place the sheet on top of the long spine board and then roll the victim and position the long spine board and the sheet at the same time. So what I'm going to do is we're first going to roll this way, and on Nathan's count, I'm going to have Zach position the pelvic wrap, and then we're going to pull it through and straighten it out. So I'm going to have you, that should work. All right, Nathan, we're going to roll on your count. And again, be mindful of where your victim's injury is and try not to move everything around any more than is necessary.
So we're going to roll on 3. 1, 2, 3.
Right, and we're going to just a hair. All right, Nathan, we'll roll back whenever you're ready.
Ready? On 3. 1, 2, 3.
And just because of the way this jacket is, we are going to have to roll just a touch the other way. So Zach, I'm going to have you trade places with me. It's on you, Dan.
Roll on 3. 1, 2, 3.
And we've got everything positioned where we want it.
And back. 1, 2, 3.
And hopefully with all of that rolling that we've done, we've gotten our victim positioned in her immobilization device, so we're done with moving and turning. Next thing we're going to do is Zach and I are each going to take a side and gently pull across the hips. Try to pull a little bit of traction right across her pubic symphysis. And then we're going to tie an overhand knot without losing that tension that we put on her pelvis with the jacket. And pull make sure we've got our tension pulled across the pelvis, and then finish tying that overhand knot. Okay, and now that we've applied our pelvic stabilization, we're going to recheck CSM Sabrina, can you wiggle your toes? Good. Tell me what toe I'm touching.
First,
Which foot?
right,
Tell me which toe I'm touching.
pinky,
Then I'm going to check your pulses in your feet. Her CSM is still intact. Also think about, as you're positioning her, that you may need to pad something under her knees or under her ankles just to maintain her comfort. And that's how you would apply a pelvic wrap.